I mean, I think that it's always good to understand that for any kind of, really test and health information that you're providing, especially if you're doing it at a population scale. But I do kind of agree with Peter's point that there is the polygenic risk score is a little bit more akin to like a cholesterol level or an LDL cholesterol level. And I don't know that you need to explain the molecular structure of cholesterol and the mechanism of detection of the assay when you're talking to a patient about cholesterol level and risk for cardiovascular disease. Like, I don't know that you have to unpack all of everything we know and don't know about genetics in order to have a conversation with a patient about the contribution of cholesterol or a polygenic risk score to the disease. But I think that's a hypothesis that should be tested.
Yeah, I think it's a great question, and I think there are really interesting issues, and we don't know the answer to it, which is how are individuals going to react to this? I mean, obviously there'll be a range of reactions. There's not great data, but there's some evidence that if you compare the two situations, one of them is you say to someone, it's a good thing to lose weight and exercise more, and another one you say to someone, here's some specific information about you in the form of your genetic risk, and it's a good thing to lose weight and exercise more. There's some limited evidence in small studies that the behavior changes are different in the second case from the first case. And we need to understand that. I think also the fact that these are risk factors and people need to think of them in a slightly more nuanced way than you are going to get sick or not get sick. And I think it's interesting if as is likely, it's used in one disease first and then another disease and then another. But when we get to the stage of 20 diseases, we'll all be at high risk for something. And then we might think about it differently. We might think, okay, in my case, I know I need to be careful about this and this, and pay particular attention to that, and my healthcare system does. So I think you're right that it would be great for us to understand those things better, and we'll do that either by research studies or in these kind of early kind of pilot research experiments by getting that kind of information.